guys, what's up? Welcome back to the channel. If you're new here, my name is Jessica. I'm a woman in long-term recovery. And today, as I'm sure you can tell from the title, we are going to be talking about our current administration and a harm reduction grant. Before we get into that, I just want to say that I know that for some people, harm reduction is a hard concept to wrap your mind around. I know that for a lot of people, harm reduction is considered something that is kind of a new concept. Harm reduction has been around for a very long time, and it just takes opening your mind a little bit more outside of doing drugs and complete abstinence. You guys know we've talked about it before. There's a million different ways that people can recover from substance use disorder, from alcoholism, from any type of addictive behaviors at all. It's for some people, it's a hard concept to wrap your mind around because you see things very black and white. A lot of people see things very black and white. You're either doing drugs illicitly or you're not. And I understand that because when I first got into recovery, I didn't know anything about harm reduction. I just want to let you guys know that, yes, I am an advocate for harm reduction now, but I wasn't always that way. And all I ask for you guys to do is just to open your mind up a little bit and do some research about it. And hopefully you will see the benefits that harm reduction gives all of us. Harm reduction isn't just about people who use drugs. Harm reduction is in so many different areas of our life. But as you can tell from the title, we're going to be talking about our current administration supposedly giving away $30 million in crack pipes. So let's do this. Before we start diving into all these details, I do just want to show you the grant that set off the big firestorm in the media and got everybody all wound up is 75 pages long. And I will have a link in my description box. If you guys want to read through it, you can. I wanted to show you guys that because everybody got so upset because our wonderful media that loves to sensationalize things and take things out of context, that's exactly what they did with this grant because they knew that it would further their war on drugs. They wanted to do something that would aggravate people, piss people off, and man, they nailed it right on the head. Grant is for harm reduction, for underserved communities that have been highly impacted by substance use disorder. What everybody reported in the media was that our government was giving away $30 million in crack pipes. And people lost their friggin' minds about that. The media just cherry picked one item. What they picked was under a section called equipment that people are allowed to purchase with this grant, or allowable activities that they are allowed to do if they are a recipient of some of this grant money. All it said was safe smoking kits/supplies. So we're going to get into all that, but the purpose of the program, this grant, and the people that are issuing the grant, is SAMHSA, and that's Substance Abuse Mental Health Services Administration. SAMHSA is the one that is facilitating the grant. It says directly from them, funding from this grant will be used to enhance overdose and other types of prevention activities to control the spread of infectious diseases and its consequences. It is concentrated on individuals with or at risk of developing substance use disorder. The concentration will be on underserved communities that have been greatly impacted by substance use disorder and will focus on meeting those populations where they are at through trauma-informed care and facilitating the use of peer support. So moving on, what does this grant do? If a harm reduction program is a recipient of this grant, what is it going to do? I more wanted to focus in this video on if it was really crack pipes or not. So one of the first things in the grant that it's going to enable them to do, handing out and educating people on overdose reversal medicine, training people how to use Narcan, naloxone. I do have a video that is a rapid revive training. If you guys are interested in that, I'll try to link that in the cards up here also. One of the big things about harm reduction in general, but focusing on this grant like we are today, building connections with people who have or may have substance use disorder. That's really what this focuses on more than anything. Building connections with people in terms of this grant means counseling, health education, referring individuals to treatment for SUD. It's also teaching people about infectious diseases like HIV, sexually transmitted infections, viral hepatitis. They're also wanting people that receive this grant to concentrate on how they can lower the stigma of substance use disorder in their community and teach people on the public health impacts of substance use and substance misuse. It also wants recipients of this grant to focus on providing education in their communities to lower the stigma for people that participate in a harm reduction program, because there's a lot of stigma that surrounds substance use disorder, and people that are in recovery, people that are in active use, all of it. But there's also a massive amount of stigma around people that participate in harm reduction programs, going to a safe injection site or a syringe exchange, anything like that. They're also going to be responsible for developing their own policies and procedures within their harm reduction program that can carry on after the grant money is no longer being received. Some of the equipment and supplies, this is the part that everybody gets all worked up about, that can be purchased to enhance harm reduction efforts. This is the stuff like straight out of the grant that they said, this is some of the stuff that you guys can buy if you are a recipient of this grant. Harm reduction vending machines and stock for those machines. Infectious diseases testing kits, a lot of those, any kind of testing kits or anything like that are really expensive. Medication lock boxes, they can allot certain amounts of this money out of the grant money that they receive to buy naloxone. Safe sex kits, including PrEP resources and condoms, because that's harm reduction, y'all. Safe smoking kits and supplies. Now, this is what got everybody all pissed off. This is what the media took and was like, oh, if we say crack pipes, it's going to blow people's mind and they're going to get crazy. You know what else is in a safe smoking kit? Things like chapstick, alcohol swabs, the glass stems that your local gas station probably sells you with a rose in it. People who use drugs are going to use drugs regardless. Harm reduction movements try to lower the harm as much as possible. So when you smoke out of a glass pipe, it gets hot, burns your lips. If your lips are open, cracked open, or you have open sores on your lips and you share your pipe with someone and you have fever blister, you just gave them a version of hepatitis. There's all kinds of diseases that people can pass back and forth. All this grant wants to do is lower the harm that people who use drugs are experiencing. Alcohol swabs, so they can wipe down their stuff. And I know people are going to be like, I wouldn't use drugs, I would never do that. And that's great for you. We're trying to protect the people that do. People that enter a harm reduction program and trust that program and use it on a regular, consistent basis are 5 times more likely to enter treatment than someone that doesn't. 5 times more likely. That's massive. Screening for infectious diseases. A lot of people that come into a harm reduction program can get tested, for all the STIs, all the sexually transmitted infections. A lot of people don't want to know that for themselves. They want to know that so they can protect their loved ones. And again, you're consistently, when you are providing services like this for people who use drugs, you're consistently building a bridge with them and showing, like, okay, I'm going to be here with you during this. I'm going to be the one that does your testing. When we get your results back, I'm going to be the one that's sitting in the room with you. I'm going to be there for you when you get upset and cry. If you need to talk to me in between while you're scared, waiting for your results to come back, I'm the one that you can come and talk to. Sharps disposal, medication disposal kits. A lot of places that do needle exchanges, they do clean for dirty. So you come in and say you have 10 needles that you've used since the last time you were there. You drop 10 in the sharps disposal box and they give you 10 clean ones. Keeps needles off of the streets, out of the gutters. When you rather someone have the ability and all the equipment they need to put that needle into something that disposes of it the correct way than dropping it in the bathroom or putting it in the trash. I would. Substance test kits, testing for fentanyl, those are massive. Those can prevent so many overdoses, it's not even funny. Syringes to prevent and control the spread of infectious diseases, vaccination services, wound care management supplies. So if you go in and, you have a wound, they can give you things to help take care of it so it doesn't turn into an abscess, so it doesn't turn into a big raging infection in your body. Some of the activities that they can do, they can hire and train people to effectively deliver the services decided on, those policies and procedures, and deliver those services through a trauma-informed approach. Implement a communication campaign focused on reducing stigma. Provide support services for individuals receiving harm reduction services. Provide public education about state Good Samaritan laws. If you guys don't know what your Good Samaritan law is in your state, look it up. Last thing I want to say to you guys is this grant that SAMHSA put out and that everybody got so upset about because the media wanted to upset everybody about it is a massive chance to make significant changes for a whole population of people that are just screaming for help. We just can't hear them. We can't hear them for a lot of reasons. People who use drugs are everywhere. Harm reduction grants help people that need help. It includes everybody, y'all. It includes homeless mothers, homeless parents, because I'm not even going to narrow it down to just mothers. People that are experiencing homelessness right now and have their children with them. It helps our veterans. It helps everybody. And I know that, especially in the age that we live in now, it's really easy to disassociate yourself and distance yourself from the headlines that you see in the newspaper when it talks about death. Like when we had the headline in the newspaper, it said 100,000 overdose deaths. That's really easy to read that and be like, oh my gosh, that's horrible, but distance yourself from it. It's not so easy to distance yourself from that death if it's someone that you know and love. For all you know, right now, someone that you love and care about very much could be using drugs and have a very chaotic, destructive relationship with them, and you don't know it. I'm going to let you guys go. I love you guys all so much. You know the drill. Thank you to all of my new subscribers. We're almost at 100, y'all. Thank you to everybody that's been here with me from the channel from the start. If you need anything, please don't hesitate to reach out. Take care of yourselves. Take care of each other. If you need Narcan or you need to be trained in how to administer Narcan, please don't hesitate to send me an email. It's linked in the description box below, and I'll get that to you ASAP. I love you guys, and I'll see you in the next one.